Estrogen helps us control inflammation and it helps us with elasticity in our muscles and joints and ligaments, ability to move, slide, and glide. It also is a time of life where if we aren't moving enough, we are losing muscle mass 1% a year. And so we don't have that same level of muscle mass, lubrication. You have to move because we become brittle if not. And you find this out when you get plantar fasciitis and adhesive capsulitis. Now, adhesive capsulitis does not happen to every woman who goes through perimenopause and menopause. Oftentimes, there are other comorbidities and things that go with it, such as a thyroid dysfunction, such as diabetes. It also happens more in women who smoke than don't smoke. So if I could say, stop smoking. If you're smoking, you got to stop smoking. Number 2, we got to get your glucose and insulin. We got to get everything under control because frozen shoulder happens when we are not optimal chemical, but it also can happen if there is an orthopedic dysfunction. But women, as they go through the transition of perimenopause to menopause, because their hormones change, everything else in their joints are changing. But nobody told you that you need to be doing 10 minutes of mobility daily and that you need to start walking and checking your steps, and I need you to start lifting 3 times a week for 20 minutes so you can get human growth hormones so your body can remodel, because it changes and your body changes and you physiologically feel it in your joints. So the average age of menopause is 51, but that is the average age. There are people that are still having their periods at 51, or maybe their period, the time between is changing, or maybe their flow level is going up and down. But I personally hear that joint pain, widespread fatigue, and kind of this malaise that you don't want to do anything happens earlier than the period changes in vasomotor symptoms, which vasomotor symptoms are hot flashes, night sweats.